and we're diving into the microbiome that doesn't always get the attention it deserves, the microbiome of your mouth. So Victoria Sampson is a functional dentist and a researcher. She's based in central London, and she's pioneering the field of salivary diagnostics and the oral microbiome and the testing field. Victoria's made global waves for her work linking oral health to overall well-being, from diabetes and heart disease to Alzheimer's and rheumatoid arthritis. She's a scientific advisor, board member and clinical lead for multiple dental companies worldwide. She's worked with NASA and the European Space Agency, and she was the first dentist in the world to link gum disease with worse COVID complications. Victoria was also shortlisted for Forbes 30 Under 30 in Healthcare and Science in Europe, and she's launched her own oral microbiome test, Oralis 1, which assesses saliva for bacteria, inflammatory markers and genetic mutations. Her talk, The Oral Microbiome, the microbiome everyone should be talking about, will explore the mouth-body connection, reveal simple yet powerful ways to optimise your oral health at home, and show how testing your oral microbiome could be the next frontier in preventative health. So please give a warm welcome to Victoria Sampson.
But basically, I love saliva, I'm a dentist, and I think that the mouth is an area that people don't really care about most of the time. And especially with all of this new conversation about the microbiome, and everyone's doing gut microbiome and taking probiotics, a lot of people I'm seeing coming into my clinic have great health everywhere else, and then they have terrible gums and they haven't gone to the dentist in 10 years, and they're wondering why they can't battle their diabetes or they can't improve their heart, their blood pressure. A lot of the time it's actually because of their mouth. So what is the oral microbiome? And I get asked this a lot. It was discovered by Anthony van Leeuwenhoek in 1683. He was a bit of a strange guy, and he basically didn't brush his teeth for a couple of days. I'm sure we've all had that time when we've forgotten our toothbrush and you get that little film on your teeth. So he scraped that white film off his teeth, he put it underneath his microscope, and he found all these different types of bacteria. And these are the first ever drawings of oral bacteria. And so this is where we found out that actually the mouth has its own ecosystem. It's got lots of different bacteria in it. And you fast forward a couple of hundred years, and we now understand that the oral microbiome is the second largest and most diverse microbiome after the gut. So everyone's talking about the gut, but the oral microbiome is actually really, really, really important. People even say that the oral microbiome is an extension of the gut microbiome. And so that means that if you're spending so much time on your gut and your mouth is a mess, then every time you swallow or you inhale or ingest anything, you're still just feeding that bad bacteria back down into your gut. We now understand that there's 700 different species of bacteria in the microbiome, and that makes up 2 billion bacteria overall. So what's quite interesting is it's very heterogeneous. And what that means is within the same mouth, there's lots and lots of different environments, or what we call ecological niches. So if you think about the environment on your teeth, which are hard, cold, certain bacteria will live there. And if you think about the bacteria which might be at the back of your tongue or underneath your gums, where it's warm, it's wet, different bacteria will also grow there. So you've got lots and lots of different environments. And to make matters even more complicated, us dentists like to come and add even more environments. So every time you get a filling or crowns, or I don't know if anyone here has any grills, veneers, braces, we're adding more and more hard kind of non-shedding surfaces into your mouth, and that will mean that bacteria can basically collect around there. So that's why it's actually really important to A, hopefully never need anything to be put into your mouth, and B, if you do need to have a filling or a crown or veneers, that you're taking really good care of them and you're getting them done well by a good dentist. So the oral microbiome in health is a very delicate balance. We all have bad bacteria, that's fine, because we have the right amount of good bacteria to keep everything balanced. So the good bacteria kind of keeps the bad bacteria in check, the bad bacteria gives the good bacteria something to do, something basically. So we've all got a little bit, but most, it's not really a problem. But what can happen is you start to get a shift into what we call dysbiosis. And this is where you have an imbalance. So we have more bad bacteria than we do good bacteria. And things that might change this shift are your diet. So if you're someone who really likes sugar, high carbs, lots and lots of starchy foods, then bacteria likes to feed on that. And so it's going to basically multiply. Poor oral hygiene. So the teeth are the only non-shedding surfaces in the whole body. So what that means is that if you don't brush your teeth, then it's just staying there, all that bacteria, and it just keeps on growing and multiplying. Whereas if you never had a shower and you decided, actually, I don't like having showers, actually your skin sheds. So you are kind of self-washing ultimately. But with teeth, you don't have that. So it's really, really important that you do actually brush your teeth, because you're physically removing that bacteria and spitting it out into your basin. Antibiotics, so obviously it's necessary, sometimes we need it, but it's a bit of an atomic bomb in the mouth and the gut, and it kind of just wipes everything out a lot of the time. And so a lot of people don't really know how to build up their microbiome after they've taken antibiotics. What do they need to do? And if you don't actually look at how to grow that microbiome, then actually a lot of the bad bacteria will start to dominate again and start to shift into that dysbiosis. Medication, so there are some medications that will mean that you've got more acidic saliva, maybe you break down sugars in a different way, maybe you've got a very dry mouth, and that will also impact your microbiome as well. Reduced saliva, and I would say this is the most important one. So reduced saliva is basically a dry mouth, and a lot of people will suffer from a dry mouth as they grow older. Zoe? Oh, do you want me to? Okay.
Hello. Oh, wow, very loud. Sorry, I hope you guys all heard me earlier. So dry mouth is essentially, I think, the most important one. And saliva is what makes the mouth go around. So saliva is, imagine this kind of delivery system, and it provides all the food and proteins that the bacteria will need, the good and the bad. So the bacteria are chilling in their little environments, on the teeth, and the saliva comes and it takes the proteins that it wants, and that's how the bacteria survives, essentially. So if you think of someone who has a dry mouth, they have no saliva, these bacteria, they have no food. And what happens is that bacteria who are able to survive in really bad environments usually become bad bacteria. They're pathogenic, they pivot, they try and become kind of worse bacteria. And this again is where we start to see a lot of diseases starting. So a lot of people have dry mouth, their risk of gum disease, decay, bad breath, all of that will increase exponentially. Genetics, so unpopular opinion from the dental community, but actually there are some people who genetically are more predisposed to getting gum disease. And that's something that I spend a lot of my research doing, is that we actually now understand that it's not always the patient's fault. It's a lot of people say, okay, well, you don't brush well enough and that's why you have gum disease. But actually there's a lot of genetics which will mean that you respond in a very aggressive way. You're a very inflamed person. So the same bacteria that maybe you have and I have, I might respond in a horrible, aggressive, inflammatory way, and you might be completely fine with that bacteria. And that's where we start to see the difference in someone who might have gum disease versus someone who doesn't. So it's not always about just how well you brush your teeth, there's a lot more to it. Smoking, so I think we all know by now that smoking is not great for the mouth, but particularly for gum disease. And so this is just a little kind of understanding of what the oral microbiome is. That is much sexier of a kind of walk-in version, but this is your digital version. So we've zoomed in through the mouth, we're onto a tooth surface here, and what will start to happen is you'll start to get your, I'm not very good with this clicker, there you go. You get what we call the acquired pellicle. So these are your kind of your starchy carbohydrates, your little glycoproteins, which will sit on the surface of the tooth. Okay, and this happens very quickly after you've brushed your teeth, and it's normal, it's fine. And then what happens is you start to get what we call your pioneering bacteria, so your early adopters. So these are the early bacteria, they come, not always bad, they can be good too, and they like to hold on to the acquired pellicle, so these carbohydrates, and I kind of think of the acquired pellicle as like a Velcro, imagine. So that's what connects the bacteria to the tooth. And then bacteria, they like to party. So when they see a few bacteria, more bacteria come. So they keep on growing and growing, and this is what we call a biofilm. So now we've got an actual film of bacteria, and they keep on growing and adding more and more to it. And then what starts happening is, if you think about the bacteria who are at the surface of this tooth, that bacteria has no access to oxygen anymore, and it doesn't really have access to saliva.
So these bacteria are saying, oh my God, well, how am I going to survive? I need to survive somehow. So they start to become pathogenic, they become bad bacteria, and they start to change in how they metabolize food and saliva, and they become basically pathogenic. And this is where we start to see disease forming. And then what starts happening is there's so much bacteria and so much biofilm on this person's tooth that this bacteria actually starts to disperse. So little chunks of this bacteria will leave the mouth, it will travel through, and it will go through to the rest of the body. So why is the oral microbiome so important, and why am I so obsessed with this? So we're going to separate it into two. So the first is your local reasons why your oral microbiome is important. This is, what is wrong with the mouth. So you have an increased risk of decay. So we know that there are certain bacteria which, if they're allowed to increase, will break down sugars and cause decay. So this is how we get cavities, basically. And then the second is gum disease. So also, if you have an imbalanced oral microbiome, you're not taking good care of it, you get gum disease. And that has, in itself, a lot of problems which we'll cover soon too. Now, what I find really interesting is actually what we call low-grade chronic inflammation. And this is the idea that imagine you have these bacteria, bad guys, in your mouth. They're just constantly just doing bad things. They're constantly releasing inflammation. And it's not enough for you to necessarily go and run to A&E and say, oh my God, I've got inflammation in my mouth. But it's low grade, it's constantly there. And this is someone who maybe when they brush their teeth, they get a little bit of bleeding gums, but they're like, oh, it's okay, it's just bleeding gums, right? That's normal. And they don't really think about that. But if you think about it, that's basically constant inflammation from your mouth. So I always compare it to, if you had an infected toe and there was constantly pus coming out of your toe, you'd probably sort it out, wouldn't you? But when it comes to the mouth, we don't really look at sorting that out. But your body is constantly under this pressure. So imagine if then you fall sick, you get the flu. And then your body's already thinking about the inflammation in your mouth, and then you get the flu as well, then it just means your body's got a lot to do. And it's just spreading itself very thinly. And then we have what we call leaky gums. And that's basically, does anyone know what leaky gut syndrome is? No? Ah, okay, we've got one guy there. Two guys, okay. So leaky gums is basically very similar to leaky guts. And this is basically, imagine you've got this, like a barrier between the outside world and your body, okay, or the gums. So the gums are your barrier. And in a healthy person, it's a really tight mesh. So only certain things can come in and out and enter the body. And in someone who's got leaky gums, that mesh is much bigger, so there's a bigger window, so bigger things can go in and out. And you don't have that kind of security control, imagine. So bad things can essentially enter the mouth, and bad things can come out as well. So now we go into how is the oral microbiome actually connected to the rest of the body. And there's three different ways that we have this. So the first is essentially you swallow bacteria. It's as simple as that. You've got lots of bacteria in your mouth, you swallow it, you inhale it, so this is going straight to your lungs. You could also just have it travel through your blood. And this is essentially bacteria translocating somewhere else. So this is where we see connections with COVID. This was the research I was doing where I said, hey, okay, so these people have really bad gum disease, and then they have COVID, and then they go to ICU, and then no one brushes their teeth because they're on a ventilator. And all of those bacteria, if you actually look at the main cause of death of COVID sufferers, it was actually through pneumonia, through a lot of respiratory disease. And if you looked actually into their autopsies, a lot of the time they had oral bacteria in their lungs. And a lot of these patients had very severe gum disease. So again, and it happens even with normal pneumonia. So the biggest cause of pneumonia, of death in people who are over 80 is hospital-acquired pneumonia. And most of the time it's to do with their oral health, and because no one's brushing their teeth. So a lot of carers don't know how to brush the teeth of the elderly, and so that becomes this kind of cycle of problems. Same with, I don't know if anyone knows what infective endocarditis is, but that's a really big cause of death where essentially oral bacteria travels down to a faulty heart valve and can cause a heart attack in a lot of people. So actually it's happening on a daily basis, but we don't really necessarily think about it. The second is metastatic injury. So what this means is basically you've got bacteria, travels through the blood, it causes lots of inflammation, it kind of fires out all of these bad things, and that will actually impact how your blood vessels dilate and constrict. So basically how much blood is able to travel through to other parts of your body. And this is where we see connections with elevated blood pressure, with heart disease, with erectile dysfunction, with so many other things. It's essentially blood not being able to travel to other parts of your body. And last but not least is what we were already talking about, low-grade chronic inflammation. So that constant firing of inflammation from your mouth elsewhere to the rest of your body. So these are just some kind of facts. So 70% increased chance of Alzheimer's for patients who have gum disease, 25% increased risk of heart disease, 20% increased risk of high blood pressure. There's a bidirectional relationship for things like rheumatoid arthritis. So if you have rheumatoid arthritis, you're more likely to get gum disease, and if you have gum disease, you're more likely to get rheumatoid arthritis, and they kind of make each other worse. For all the men out there, 3 times more likely to get erectile dysfunction, and also there's strong connections with male infertility, female infertility, and reduced pregnancy outcomes. So we're now understanding that actually, and there's a lot of gynecologists who are sending their patients to me saying, hey, my patient, can't, I don't know what's wrong with them, but they're not able to conceive. And then we do a full check on the man and the woman, and we find out that they both have raging gum disease and they've got really bad infections. And actually by treating that, we're able to improve their fertility. And there's a lot of research in Malawi where it's got the highest rate of preterm births in the world. So about 17% of women have preterm birth in Malawi. And preterm birth is then a massive predictor for the quality of life for that child. So it's a huge burden on the health system in Malawi. So weirdly, Wrigley's, the chewing gum company, went to Malawi and said, hey, what can we do to help improve this? And they gave these women toothbrushes, toothpaste, and sugar-free chewing gum. And they split it into 2 groups, and half the group went to brush their teeth, etc. The other half were left to whatever they usually do. And they found a 25% reduced risk of preterm birth in the women who just brushed their teeth a little bit more. And something so cheap and so easy is actually able to improve things so significantly. 3 times more likely to get diabetes, and again this is bidirectional, so it goes back the other way too. An increased risk of colon cancer, so that's been a big one at the moment in the newspapers, and we're seeing that there's oral bacteria traveling, and they're finding that it's specifically more connected to colon cancer. So my question to you is, if you had an infected eye like this, would you leave it alone? I hope not. Okay. How about if you had a bleeding eye? I'm sorry, it's a bit early for this morning, but if you had a bleeding eye, you woke up, blood going down your eye, you probably run to you go and see your doctor. But for some reason, like I said, people don't think about that. And the issue is that 13 million people are unable to access an NHS dentist. There's a huge rise in privatization at the moment because of that, because dentists are not able to do the work that they want to. I'm a dentist, I used to work NHS, I'm not able to sometimes provide the care that I want to. And so it's making this massive gap, unfortunately. 10% of the global population have severe gum disease, and that's 1 in 5 people in the UK have severe gum disease. Tooth decay is the main reason for general anesthesia in kids, which is very sad. And gum disease has now been seen as one of the most common and avoidable diseases by the World Health Organization. They said it was the 7th most common inflammatory condition in the world, and it's completely reversible. So what can we actually do about it? So, visit your dentist, go and see your hygienist. Hopefully if there's one thing you get from this, it's to go and see your dentist and your hygienist and actually get what you need to do done. They do all the work for you, essentially. Okay, and ideally every 6 months. This is my clinic, we're in Mayfair, and we basically, our main focus is looking at how the mouth is connected to the rest of the body. You can test your saliva, so this is my oral microbiome test for disclosure, but it's a saliva test, and you can actually check for all the bacteria you have, genetic mutations, inflammation. There are other tests on the market as well, but just like you might test your gut microbiome, why not test your oral microbiome? And actually, if you, for example, have one of those other conditions we said, like Alzheimer's, diabetes, heart disease, high blood pressure, all of those, you might want to tackle it from another angle and try and help your mouth out first. And and brush twice a day, spit, don't rinse. So a lot of people have been taught that they should rinse their mouth out with water after they brush their teeth. Thank you very much. And I like that nod that you're like, no. So no, you don't. You need to just spit out what you have from the basin and walk away. And the idea is that we want to keep all the goodness on our teeth for as long as possible to help with remineralization. Floss. So 30% of bacteria is actually found in between your teeth. So if you're not flossing, you're only doing 70% of the job. These are my two favorite flosses. Yeah, they're very nice. This one's really nice. It's a bit fancy, but it's got prebiotics in it, and it's vanilla cocoa butter. So that's my favorite floss, but it's very nice. Oral probiotics. So we were just speaking earlier about some, probiotics and putting good bacteria back into the mouth. So there's lots and lots of probiotics on the market, and that's just a way of kind of helping rebalance that, the balance essentially. Eat right. Okay, so diet. I love cheese. Cheese is fantastic for your mouth actually because it's high in calcium, it doesn't have very much sugar in it, it's high in protein. So I always have, I know it's probably not the healthiest, but I always have a baby bell in my bag just in case I'm a bit peckish. I just whack out a baby bell. Kefir, fantastic. Sometimes this is where the dentists and the kind of doctors and nutritionists and functional medicine practitioners, maybe we part a little bit with our agreement on this. So things like your kombucha, your apple cider vinegar, your lemon is like a dentist nightmare because it's super acidic and citrusy and you're going to lose all of your enamel. So if you're going to do it, fine, go for it, but do it all in one go. So never sip on lemon water throughout the day. If you're going to do your apple cider vinegar in the morning, have a shot in the morning and then drink water straight after. So you don't want to be drinking it throughout the whole day. And if you're going to choose between kefir and kombucha, for example, I would always go for a kefir because it's a little less acidic for the mouth. Beetroot. So beetroot is actually really, really good for helping improve your nitrate-producing bacteria, and that's actually been shown to have a knock-on effect on your blood pressure. So huge fan of beetroot. Dark leafy greens, exactly the same thing. Green tea, so green tea, it does stain your teeth. Again, another dentist nightmare, but it's okay, we can handle the staining because it's actually really antibacterial and antioxidant for certain bacteria in the mouth, which is very important. So I prefer that. I prefer you had stained teeth, but no bad bacteria. So that's kind of it. I've just given you a little speed kind of journey of the oral microbiome and dentistry. I'm here if you want to answer any, ask any questions. I can't remember what that QR code is for, but I think it's, I think it's for me or my task. I don't know, but you can check and tell me. Yes.
You might need the mic. Oh yes. I don't know it. I can do if I move it closer. Yeah.
It's more a curiosity question.
Sure.
I asked a similar thing yesterday, like before Rockefeller and the modern age, for thousands, tens of thousands of years, humans have existed.
Yeah.
What did they do to look after their teeth, and how do they compare to modern day times? Thank you.
That's a really, really good question. I could speak about that for a whole hour. So there was a guy called Weston Price, and he traveled around the world, and he was very curious of exactly that. So he went to a lot of villages where it was kind of not westernized. So he went to these kind of unwesternized areas where they were still maybe having a caveman diet. They weren't brushing their teeth with their Colgate toothpaste and their electric toothbrush. So he was seeing, do they have worse oral health? And how do their jaws, develop and all of that? And interestingly, they all had no decay, no gum disease. They had fantastically well-developed jaws. And the reason for that is unfortunately because of our westernized diet. So we are eating softer foods, we're having more carbohydrates and sugars in our diet. And so again, sugar is going to increase your risk of decay. Softer foods means that your jaw doesn't develop the way that it should when you're younger. And that's why most of our children need braces, because their jaws haven't developed properly. And gum disease as well. So because they're not having a lot of sugars and they're having a lot of hard, rough foods, that actually kind of like flosses and brushes their teeth for them in a way. So the old times they even used to use mesvak or even tree bark, and that actually works quite well. But unfortunately, we can't do that anymore because of our westernized diet. And so I get asked by a lot of people, oh, well, why do I need to floss? Do I have to floss? Because in the caveman times, they didn't floss. I'm like, yeah, okay, but then you should only be eating meat and
like not even vegetables. Like you should just be basically eating meat and drinking water, and then fine. You don't need to use toothpaste or go to the dentist probably either. So,
I've been told that if you're constantly swimming, the chlorine in the swimming pool will strip the enamel from your teeth. Is that correct?
if you're a real big swimmer, yes. I can't remember the exact statistics, but it's like a certain number of hours a day that you do need to be in the swimming pool. It's mainly just because chlorine is slightly, if I'm correct, acidic, and so that acid is going to be stripping your enamel, just like if you're drinking lemon water all day, essentially. You're essentially drinking chlorinated water or having it on your teeth all the time. So I have a few professional swimmers, and they might even wear like a guard when they're swimming, like a night guard or something, just to protect their teeth.
Can I ask, what's your advice around teeth whitening products and those kind of things that people go for?
So I'm not that against it. There's a lot of like natural teeth whitening things like charcoal, bicarb soda. I've even had people use oven cleaners on their teeth. That is an absolute no-no. Like, please do not do any of those things because it's really abrasive and it will just strip all the enamel, and it might look white for a day and it will actually become more yellow than what you originally had. So at the dentist, you usually have two options. One's in-chair whitening, which is where the dentist does all the whitening for you. It takes like an hour and you come out with whiter teeth. Or you can do at-home whitening. And the whitening systems on the market now mean that at-home whitening, in my opinion, is actually not that damaging. So it's the equivalent, the system we use is called Enlighten. It's the equivalent of having one Coca-Cola. Every day that you whiten is like having one Coca-Cola, or for you guys, probably one kombucha a day. So it's actually, in the grand scheme of things, like, we do far worse things for our teeth and our mouths. So I have no problem with it, and actually, weirdly, it's very antibacterial. It uses hydrogen peroxide, so it actually, for some people, can help their microbiome, and you can take a few probiotics afterwards, and it's quite nice, actually. So, yeah. Oh, I think there's one question, and then yeah.
What will all these mouthwashes do to the gut microbiome? So the oral microbiome.
Yeah, so that's a great question. Generally, I don't recommend anyone to use just over-the-counter antibacterial mouthwashes because they wipe out the microbiome. And we see, so from our microbiome test, I look at all the results, and I can automatically see when someone is like I will not say names, but some certain mouthwash users, I can see that immediately because they just have no good bacteria. They don't have bad bacteria either, but they just have nothing in their mouths. So I personally only recommend mouthwashes as kind of like a prescription. Like, your dentist should tell you, okay, use this mouthwash for 3 weeks because you have gum disease, or because you have high risk of cavities, use this. But you shouldn't just go and just buy one from the counter, or you should do a microbiome test and see what you need to fine tune and improve a little bit more. I think we have one question there.
Okay.
Or you can. Or
I just got a quick one. Can I ask about fluoride? Are you for fluoride or not for fluoride?
There's a reason I didn't put that on there, but thank you. No, I'm in the middle. My clinic, I'd probably say 60% of my patients don't use fluoride, and I want to be a space where you can do whatever you like and no one's going to judge you. On the flip side, I'm seeing a lot more children who are non-fluoride toothpaste users with far worse cavities than their counterparts who are using fluoride, and that's very worrying for me. Like, I'm talking, 10 teeth out, 15 fillings on an 8-year-old. Like, that's not good at all. So I guess it kind of goes back to what we were saying earlier about, like, it depends on the rest of your lifestyle and your food, your nutrition. So if you are someone who has a low sugar diet, you take very good care of yourself, you're brushing 2-3 times a day, you're doing it correctly, then you could probably go for a fluoride-free toothpaste option. It's still remineralizing, but in my opinion, it's not been shown to be as remineralizing as fluoride. But that's okay because you're doing everything else right. If you're someone who's maybe very medically compromised, very dry mouth, you're a kid or you've got kids and you cannot stop them eating sugar, you might go for a fluoride option. And there are now some which are in the middle, which are really nice. So there's one called Biomin
out of stock everywhere, but when it comes back in stock, you should get it. And it's there's a lot of new toothpaste which are low fluoride. So a normal fluoridated toothpaste is like 2,800 parts per millimeter of fluoride, and this will have like 400. So it's got just enough to be doing something, and then it's got calcium, phosphate, hydroxyapatite. And one last thing, sorry, I could again speak about this forever. If you're not going to be using fluoride, use hydroxyapatite toothpaste. Please do not go and get these like cool aloe vera, coconut toothpaste with nothing in them, because that's the worst. You're doing nothing basically to your teeth. Oh, Biomin, B-I-O-M-I-N. That's it, yeah.
Hi, I wanted to get your opinion on the water floss.
Yeah.
That you can buy. So instead of using floss. Yeah.
I still prefer floss. Like if I had to choose, I was on an island and I could only take my floss or my water pick, I would still always choose my floss. If you're someone who, some people hate flossing and the sensations, fine, use a water pick. But if you think about floss, it physically will go in between the whole surface of the tooth, whereas a water pick is not really going through across the whole tooth. So it's more of like a nice adjunct as opposed to a necessary in my oral hygiene routine. Yeah.
Excuse me, actually got two questions
Sure.
here. First one, about flossing,
Yes.
or about the little incidental brushes.
Yeah.
They're fine, yeah.
They're fine, and it honestly, it depends on, I would say, I would speak to your hygienist and see what works best for you. So if you've had like gum disease in the past and you've got really big windows in between your teeth, floss is just going to get lost. Maybe you need a TP brush. So they should be able to fine tune and tell you exactly what works best for you.
Okay. The other thing is, I guess we all know about the sugary drinks.
Yes.
But what about all the other things we drink? Tea, coffee, alcohol, whatever.
As in, are they which ones are bad and good for you?
What the general effect on the oral microbiome.
Or microbiome. So I guess coffee is actually like not that bad, except for it dries your mouth out if you're like a really serious coffee drinker. But otherwise, as long as it doesn't dry your mouth out, no problems. Sugary drinks, yes, that's not a good thing. Alcohol usually has sugar in it, therefore it's not going to be great for you. If you want to really have some alcohol and you're thinking, which one should I go for? Tequila probably has the least sugar in it, so I guess I'm saying you should have some tequila. But like for example, wine has a lot of natural sugars in it that's actually very acidic, and that can be a big problem. And then if you are a coffee tea drinker, putting sugar is the worst thing you can do, because it's hot, and the sugar will then have a bigger impact on your teeth as well. Milk is great. I'm trying to think of what else you can drink. Tequila, milk, water, coffee, tea, and yeah, juices, be careful as well. That can be very acidic too. So again, have it all in one go and don't sip things throughout the day. Okay? I think, yeah. We can, if you want to speak.
We have our last question at the back.
Sure.
Hello, there's been recent advice about brushing your teeth before or after breakfast. Can
Yes.
you sort of go into that a bit more? What's best, before or after?
To be honest with you, there's evidence for both of them. It really, in my opinion, depends on what you're having for your breakfast. So if you're someone who, for breakfast, is going to have like 4 grapefruits and lots of citrusy, sugary, acidic things, I'd rather you just brush your teeth before you had your breakfast. The reason being is that when you have lots of citrus and lemon or sugar, and then you brush your teeth, you just grind all of that straight into your teeth. So ideally you need to wait 30 minutes between eating and brushing your teeth, but by that point I've probably lost you anyway, so I'd rather you just brush your teeth before you started. Or you can definitely do that. If you're someone who has muesli with no sugar, nothing in there, you can brush your teeth straight after to get rid of it. So it really depends on what you're having in my opinion.
If you'd like to join me in thanking Victoria.